Hi, my name is Nurse Mikey, and today I'm going to tell you a little bit about my friends, them good old hemorrhoids. Yep, that's me, and enjoy my song choice today, and please ignore my free trial version. Anyways, let's get to it. Hemorrhoids are usually caused by increased pressure due to pregnancy, being overweight, or straining during bowel movements. Hemorrhoids are associated with chronic constipation, straining during bowel movements, and prolonged sitting on the toilet, all of which interfere with blood flow to and from the area, causing it to pull and enlarge the vessels. This also explains why hemorrhoids are common during pregnancy, when the enlarging uterus presses on the veins. By age 50, about half the population has experienced one or more of the classic symptoms, which include rectal pain, itching, bleeding, and possibly prolapse, hemorrhoids that protrude through the anal canal. So what exactly are hemorrhoids? Hemorrhoids are swollen veins in the lowest part of your rectum and anus. Sometimes the walls of these blood vessels stretch so thin that the veins bulge and get irritated, especially when you poop. Swollen hemorrhoids are also called piles. There are two types of hemorrhoids: internal and external hemis. So let's go ahead and take a look at the internal hemorrhoids. Boom, there you have it. Internal hemorrhoids are far enough inside the rectum that you can't usually see or feel them. They don't generally hurt because you have few pain-sensing nerves there. Bleeding may be the only sign of that. And let's go ahead and take a look at external hemorrhoids. Go ahead and take a look at that external hemorrhoid on that monkey. Boy, oh boy. External hemorrhoids are under the skin around the anus, where there are many more pain-sensing nerves, so they tend to hurt, as well as bleed. A blood clot can form in an external hemorrhoid, turning it purple or blue. This is called a thrombosis. It can hurt and it itches a lot and could bleed. When the clot dissolves, there may still be a bit of skin left over, which could get irritated. And let's talk about the prolapse hemorrhoids. Sometimes hemorrhoids prolapse or get bigger and bulge out outside the anal sphincter. Then you may be able to see them as extreme moist bumps that are pinker than the surrounding area, and they're more likely to hurt, as you can see. This is more of a concern and will need a hemorrhoidectomy. Small prolapse hemorrhoids usually go back inside on their own. Even if they don't, they can often be gently pushed back into place. Eek. So, how exactly are hemorrhoids diagnosed? Hemorrhoids can usually be diagnosed from a simple medical history and physical exam. External hemorrhoids are generally apparent, especially if a blood clot has formed. The physician may perform a digital rectal exam to check for blood in the stool. She or he may also examine the anal canal with an anoscope, a short plastic tube inserted into the rectum with illumination. If there's evidence of rectal bleeding or microscopic blood in the stool, flexible sigmoidoscopy or colonoscopy may be performed to rule out other causes of bleeding, such as colorectal polyps or cancer, especially in people over the age of 45. Treatments. Yes, dramatic relief for most hemorrhoid symptoms can be found with simple home remedies for hemorrhoids. You always want to get more fiber. Add more fiber to the diet from a fiber supplement such as Metamucil, along with adequate fluid. Fiber softens stools, and high fibers include broccoli, beans, wheat and oat bran, whole grain foods, and fresh fruit. Fiber supplements help decrease hemorrhoidal bleeding, inflammation, and enlargement. They may also reduce irritation from small bits of stool that are trapped around the blood vessels. Now, exercise. Moderate aerobic exercise such as walking 20 to 30 minutes a day can help stimulate bowel function. Taking time. When you feel the urge to defecate, go to the bathroom immediately. Don't wait until a more convenient time. Stool can back up, leading to increased pressure and straining. Also, schedule a set time each day, such as after a meal, to sit on the toilet for a few minutes. Now, sitz bath. A sitz bath is a warm water bath for the buttocks and hips. It can relieve itching, irritation, and spasm of the sphincter muscle. It is a small plastic tub that can fit over a toilet seat, or you can sit in a regular bathtub with a few inches of warm water. A recommended 20-minute sitz bath after each bowel movement and 2 or 3 times a day in addition. Now, seek topical relief for hemorrhoids. Over-the-counter hemorrhoid creams containing a local anesthetic can temporarily soothe pain, or suppositories such as Preparation H, witch hazel wipes or tucks are soothing and have no harmful effects. A small ice pack placed against the anal area for a few minutes can also help reduce pain and swelling. Now, how about procedures for hemorrhoids? That rubber band ligation. Rubber band ligation is the most common procedure to treat internal hemorrhoids and is very effective. After inserting a device called a syringe ligator into the anus, the physician will gently draw the hemorrhoid into the device, twisting it slightly and locking it into place. I had this done and it really wasn't nice, but I guess they say this is a great process for the hemorrhoid to cut off the blood supply pretty much. There's the coagulation therapy. This is most common type of a coagulation therapy. It's infrared photocoagulation, in which the physician uses the heat from an intense beam or infrared light to cut off the fibrous tissue. There's cryosurgery, and in this procedure, the physician will use a local anesthesia to numb the area before applying either a nitrous oxide or liquid nitrogen, and it pretty much freezes the internal and external hemorrhoids, ligating it off to freeze them. Then there's the hemorrhoidectomy. This procedure involves the surgical removal of the hemorrhoid using a scalpel, laser, or cautery pencil, and this one usually takes a longer treatment and healing time. Well, in conclusion, if you're pregnant or genetically predisposed to developing symptomatic hemorrhoids, there may be a possible to prevent, but the following tips may nonetheless lower your risk of experiencing them. Consume a well-balanced meal with meal and snacks, ensuring high fiber content and adequate fluid intake. Avoid sitting or standing for long periods. Take short walks whenever you can. Do not delay bowel movements when you feel the urge. And last but not least, thank you so much for watching.